Viewers, welcome back on Health Matters. हम बात कर रहे थे डॉक्टर कुमार के साथ ऑन फूड एलर्जीज एंड बच्चों में कॉमन क्यों हैं. अगर आपके बच्चों को अगर ऐसी कोई प्रॉब्लम है या आपको कोई ऐसा लगता है कुछ ऐसा है तो आप इस बात को ज़रूर सुने और आप हमें ईमेल भी कर सकते हैं healthmatterslive@gmail.com पे. आइए हम डॉक्टर साहब से ये और जानें. Yes, doctor. We were talking about the food allergies and how you were saying they're most common in kids because they're exploring and they want to eat everything and find out and get the taste of it. So how can we diagnose that a child has a food allergy?
The symptoms of food allergy, especially in infants and very young children, are developing rashes soon after eating a particular food, or suddenly throwing up, that is vomiting again and again after eating that particular food, or they can also have asthma attacks too. In some cases where food allergy is severe, it can result in asthma attacks too. And the most extreme case of food allergies, especially usually not common with milk and eggs, but it's very common with peanuts and shellfish and nut allergies. One can develop swelling of lips and tongue, and in rare cases, they may choke to death.
So the parents should be aware of when a child has a lot of vomiting or swelling of the face, so they should consult their doctor
They should consult their doctor, and if necessary, the doctor may arrange for an allergy consultation.
But Dr. Kumar, why is peanuts, the nuts, and milk the most common allergies for kids?
That's a very good question, but to tell you the honest answer, we do not know why some particular foods cause very severe, extremely severe allergies. I think it is the way the molecules in those foods are designed. They are more apt to cause allergies, more common than other food substances.
So the tests that they do on the kids and adults to check food allergies, are they similar or are they different?
For very young children and infants, we usually do blood test.
Okay.
We look for immunoglobulin E against a particular food substance. That's how we diagnose allergies in very young infants. But once a child is about 3.5 to 4 years old, it is pretty safe to do skin testing.
Skin testing.
For the food allergies. But one case where we like to avoid the skin testing, whether it be adult or infants or children, is if there is a history of extreme case of allergy to a particular substance, like if somebody had peanut allergy which landed them in the hospital and
Yes.
they developed asthma or almost choked to death, we would not like to do the skin testing in those cases.
Yeah. So Dr. Kumar, these are the food allergies. There are drug allergies too. How are the
Exactly.
symptoms are to those?
The symptoms are more or less the same. As soon as the medicine is taken, within about 20 minutes to anywhere 2 to 3 hours, patient can develop itching in the mouth, itching on the skin, and widespread rashes on the body.
Yes.
Along with itching. But then again, there are different kinds of drug allergies too. That's another whole topic. So you can have rash up to a week after taking the drug. So to diagnose a drug allergy, sometimes, especially when people are on multiple medications for multiple problems, it's a long detective work. Sometimes it's trial and error. There are no skin testing for drug allergies except for very few of them.
Okay.
There is penicillin and certain penicillin-related drugs. Other than that, there are no skin tests or even lab tests
For the drug,
diagnosing
for
them.
the drug allergies.
Many times you have to go by intuition, you have to go by correlation of when the patient took it, when the rash appeared, and things like that.
So they calculate the times of
Exactly.
the incidents, when, what, how, and what have happened.
Yeah.
Dr. Kumar, also, I would like to ask you that, you know, like when you eat a painkiller, they recommend to have it after 4 hours or 6 hours or any drugs. So if a person does not take it between those time, and if they take it within an hour, would that count as a drug allergy or no?
No, no, no. That's they recommend it to be taken at a certain interval because of its what we call pharmacokinetic characters, because how soon it is metabolized in your liver
Yes.
and thrown out of the body. Some drugs are thrown out faster, some drugs they stay in the body almost weeks.
Okay.
Depending on that, they come out with how often the drugs should be consumed.
Okay. Dr. Kumar, I would like to ask you, once a person is diagnosed with allergies such as food or drug or just indoor allergies, how often should they be tested for their allergies?
There is no need to test again and again unless if the treatment is not working.
Okay.
Then at a later interval, probably in 6 months or a year's time, then you have to stop and think, did the patient develop some new allergies? Did the patient go to a different place, come in contact with a different thing? And those clues should prompt a new allergy test for the new allergen which is suspected.
Okay.
Otherwise, I don't think it is
So once
necessary.
once they diagnose with allergies and they start taking medication, they're good to go as long as the medication is
Exactly,
working.
yeah.
And if it doesn't work, then they have to get it retested
Yeah.
for the new allergy which is developed.
Yeah,
Okay.
if suspected.
If suspected,
Not
okay.
otherwise.
Doctor, I would like to ask you, what is asthma and how does it works in allergies?
That's a big topic. Asthma is, to put it in a nutshell, asthma is the way your lung, the bronchial tubes, not exactly the lungs, the bronchial tube responds to something irritant we inhale. Some people respond to a lower concentration, some people will respond to a higher concentration. But people with asthma respond with wheezing to a very low concentration of the substance they inhale. In other words, it is called hyper-responsiveness of bronchial tubes. That is the definition of asthma. So it is clinically people experience when they have asthma, like they feel tightness in the chest, they start coughing,
Yes.
and the extreme case of which is they start wheezing and making sounds. The sound is especially when they breathe the air out of their lungs.
Okay, so asthma only happens to young people, or it can happen to adults at any age?
It can happen at any age, but it's more common in younger age group.
Okay, and why is it common and more in young people?
Like I said, again, young people are coming in contact with newer and newer stuff,
Yes.
inhaling newer and newer stuff in their developing years, and if they have allergic and asthma potential in their constitution, in their genetic constitution, then they experience the clinical symptom of asthma.
Okay, so allergies and asthma, can they be really serious and complicated together as a combo?
Exactly. There are various theories, whether allergies do cause asthma, yes and no. There is no straight answer.
Okay.
But if somebody already has asthma and has no history of allergies, I don't think allergies may play a part in complicating the asthma. But if somebody has allergies and asthma together, there is a good possibility, actually greater possibility, that allergies are always triggering the asthma. So treating the allergies will definitely make life much better for an asthmatic patient.
Yes. Dr. Kumar, what is a sinus? When we hear people say, oh, I had a sinus problem, or I went to get my sinus checked, what is actually sinus?
Sinuses are air-filled cavities on the sides of your nose and above the eyes, around the eyes, inside of the eyes, they kind of give you a shock absorber effect just to protect the brain, just in case of an injury. Your face gets fractures, but the brain remains unhurt. That is one of the uses of having sinus cavities around the brain. So all these sinus cavities communicate with the nasal cavity, both sides of the nose, where you breathe air through tiny holes called openings. So when these openings are clogged, the sinus cavities get filled with fluid, which eventually become infected. This may happen not just because of allergies.
Yes.
It can happen right after a virus infection or a common cold. But having allergies all the time will make the mucous membrane swell and they clog the openings. Once the openings are clogged, there you go. The secretions get pent up and they cannot come out, and that acts as a nidus for bacterial growth, and you can have sinusitis.
Okay, thank you, doctor. Now I'd like to ask you, what's the difference between a cold and a flu? Some cold lasts just like flu, but when people say I've got a cold or I've got a flu, what do they actually mean by cold and flu?
Cold is just a cold virus. There are many, many viruses which catch cold. You cannot catch cold just out of the air. You have to have somebody having cold around you. So when you say you have a cold, it is usually somebody in the community where you work, to a home or family, somebody is having a cold infection. That's how you catch it. Usually you get rid of it within a week or so. On the other hand, flu, though it starts out as a cold, the symptoms are extremely severe. You have one important symptom is severe body ache, muscle ache. And also at the same time, you know that there are flu cases reported in the community. That's how you get it.
Okay. Doctor, now it's a time for a short break. व्यूअर्स हम जल्द हाजिर होंगे एक छोटे से ब्रेक के बाद, और हम और जानेंगे कि कोल्ड और फ्लू में क्या डिफरेंस है और हम इसको कैसे प्रिवेंट कर सकते हैं.